In this video, we'll discuss rheumatoid arthritis, a chronic autoimmune disease that primarily affects the joints but can involve multiple organ systems. Stay tuned for 3 multiple-choice questions at the end to test your knowledge. Vital Nursing 101, your ultimate guide to nursing success. What is rheumatoid arthritis? It is a systemic autoimmune disorder that causes chronic inflammation in synovial joints. What happens is that the immune system attacks synovial membranes, causing synovitis. Over time, this leads to cartilage destruction, bone erosion, and joint deformity. Now let's talk about the clinical presentations of rheumatoid arthritis. Clinical presentation includes both early symptoms and systemic symptoms. Early symptoms are morning stiffness lasting more than 1 hour, symmetrical joint swelling such as in the hands, wrists, and knees. Systemic symptoms are fatigue, fever, and weight loss. There are also extra-articular manifestations which include the following: rheumatoid nodules, vasculitis, and lung involvement, for example, interstitial lung disease. Okay, now let's go over the diagnostic criteria, which are the following: rheumatoid factor, RF, and anti-CCP antibodies, elevated ESR and CRP, and imaging, where X-rays show joint erosion and narrowing. Medications for rheumatoid arthritis are DMARDs, biologics, NSAIDs, and corticosteroids. Let's learn about each medication now. DMARDs, or disease-modifying anti-rheumatic drugs, include methotrexate, which is often the first-line treatment. Biologics include TNF inhibitors. NSAIDs and corticosteroids are used for symptom relief. There are also non-pharmacological interventions, which are the following: physical and occupational therapy, assistive devices to maintain mobility. The nursing actions for rheumatoid arthritis are the following: educate patients about medication adherence, monitor for side effects, such as methotrexate toxicity, encourage joint protection strategies, and a balanced rest and exercise routine. Alright, now let's practice some NCLEX-style questions. Question 1. Which of the following is a hallmark symptom of rheumatoid arthritis? A. Joint pain worse with activity. B. Morning stiffness lasting more than 1 hour. C. Swelling in a single joint. D. Asymmetric joint involvement. And the answer is B. Morning stiffness lasting more than 1 hour. This is a classic feature of RA, distinguishing it from osteoarthritis, where stiffness typically improves with activity. Question 2. What is the first-line medication for managing rheumatoid arthritis? A. Prednisone. B. Methotrexate. C. Etanercept. D. Naproxen. And the answer for this question is B. Methotrexate. Methotrexate is a DMARD and the gold standard for RA treatment due to its ability to slow disease progression. Question 3. Which diagnostic finding is most specific for rheumatoid arthritis? A. Elevated ESR. B. Presence of rheumatoid nodules. C. Positive anti-CCP antibodies. D. Joint space narrowing on X-ray. The answer for this is C. Positive anti-CCP antibodies. Anti-CCP antibodies are highly specific for RA and often appear earlier in the disease compared to RF. Rheumatoid arthritis is an autoimmune disease with joint and systemic involvement. Early diagnosis and treatment are critical. Alright, well, that ends this nursing review. If you found this video useful, leave a like and a comment so we can continue to make more videos like this. Also, if you have any study tips, leave them below. I'd love to hear from you.